warm welcome to everybody. My name is Uzodinma Iweala, and I'm the CEO of the Africa Center here in Harlem, New York City. And I'd like to welcome you all to Hope, Fear, Trust, African Leaders in Science and the COVID Vaccine. We're all super thrilled that you're joining us today for this very important conversation featuring 3 African leaders in science. I'm joined today by Dr. Wafaa El-Sadr, the founder and director of ICAP at Columbia University, Dr. Onyema Ogbuagu, who leads Yale's clinical studies around COVID-19, and Dr. Osman, a behavioral scientist who is spearheading a series highlighting research exploring the profound and diverse impacts of racism on the health of Black people here in the United States. So I'll just, as a note, just let you know that if you want to use closed captioning for this program, you can watch it on our YouTube channel and just select the closed caption option. And there are multiple ways to view YouTube, Facebook, etc. Or if you're logging on right here with the Zoom link after registering. But please do that if you want to have the closed captions. And here at the Africa Center, as you all know, and if you don't, now you do, our work is focused on transforming narratives about Africa by centering human stories on the continent, of the continent and its peoples and our contemporary cultures, policy, and business. We're bringing this program to you in recognition of the seemingly contradictory facts about people of African descent. On one hand, we know that the legacies of colonialism and systemic racism continue to perpetuate mistrust between some of us and medical systems. And on the other hand, we have also historically been leaders and inventors in these very systems. This discussion today is aimed at highlighting the nuances left out of mainstream narratives about people of African descent and how we interact with health systems. I hope that you find it provoking and informative. And please be sure to follow the speakers to keep updated on what they're doing and to support their work. And you can also keep in touch with us at the Africa Center by following us at the Africa Center. And we spell the Africa Center, ER, that is the American way. We have a sister institution in the UK that spells it the other way. So Africa Center, center spelled CENTER. For those of you who want to follow us on our various social media platforms. So with that introduction, I will now turn to our wonderful and esteemed panelists and just invite them. Dr. Osman, it's very good to see you.
Good afternoon, and thank you for having me on this panel. It's an honor, and I really look forward to delving into this topic in depth. It's a topic that's very close to my heart, being of African descent myself, and having to deal with a lot of the issues that have come around dealing with COVID, as well as vaccine hesitancy, and I think importantly, vaccine accessibility in our community, and from family members to cousins to friends. It's really formed the majority of my work over the last few months. And so I look forward to hearing from some of my other panelists and really getting into this conversation today.
It's good to have you. And Dr. Onyema Ogbuagu, it's good to see you today.
Yeah, I just want to say hi to everyone. I thank you for taking out time of what's everyone's busy day. For some of you, this might be your 4th Zoom webinar, like it is for many of us. Just by way of introduction, I just think that, I've been involved with, a lot of the clinical trials for COVID-19. And I think that we've all been thrust somewhat into a public ambassador or speaker role, to really try to explain some of the science behind some of the work that has gone on. And really, like was said by Dr. Osman, we've all been trying to address the issues with regards to just how Black and Brown communities participate in research and also respond to getting the vaccine. So I think for all like this, critically important to keep getting the word and the message out from experts, and very happy to be part of the program today.
Thank you, Dr. Ogbuagu. And Dr. Wafaa El-Sadr, it's good to have you here, and also congratulations on your new appointment as well.
Well, thank you very much. It's a pleasure and an honor to be on this webinar, and I've been really looking forward to this particular webinar because, of course, of the importance of the topic, but also importance of this organization and importance of consistently highlighting the important dimensions of this pandemic as it relates to the African continent and individuals from Africa. And I'm particularly honored to be with the other with the other panelists, colleagues and friends, and look forward to a conversation where we can each bring our varied perspectives to a diversity of topics. Thank you very much.
Awesome. So let's just get right into it. And let me ask as a general question to all of you. You know, this past year has been, you know, I know of no other way to say it than it's been a year for everybody, a year and then some. You know, now things are looking up in that we have vaccinations thanks to the efforts of some of you on the panel here. Those vaccinations are getting out thanks to the outreach efforts of all of you guys on the panel here. So can we talk a little bit, like, what has this year been like for each of you as health professionals, as clinical providers, as public health experts? How has this year gone? I'll throw it open, but let's start with Dr. El-Sadr.
Yeah, that's a tough question. It's been a tough year. I think as everybody probably around the world has lived through very difficult times in a lot of different ways. I personally have been. You know, when this came about, the first evidence of this pandemic, it was a very critical moment because for someone like myself, who's my area of specialty is infectious diseases and public health, this was a moment of great apprehension and fear and anticipation because for many of us, we've been talking about the possibility that there will be a pandemic of this nature coming soon. And also having been involved in the HIV, in the response to the HIV pandemic, another pandemic we're still living through, I also was keenly aware of what the impact can be on communities and particularly on the vulnerable and disenfranchised communities, both in this country, in the United States, and around the world. My experience has been since I started my career is that epidemics and pandemics and crises like these, they shine a light on disparities that we know exist and have existed for years and years and decades and probably centuries. But they shine a light on those very disparities. And of course, there was no surprise when we started noticing some very alarming trends in terms of who's most severely affected and who is most likely to get infected and who has access to what, whether it be treatments or vaccines and so on, both in the US as well as around the world. And I think also for me, it was an experience of, I also experienced the sense of frustration and in many ways disappointment because we have all been keenly aware that we were going to face such a pandemic sooner or later, and yet what was obvious around the world, but in particularly in very highly resourced settings like the United States and Western European countries and so on, is how the system just failed completely from day one. There were, whether it be in terms of the, at the beginning, the ability to provide the services, the care, the support for people who are affected, or scaling up of the testing for SARS-CoV-2, or whether it's access to new treatments or access to vaccines and confidence in vaccines. It was very indeed disappointing and frustrating to see how for all those decades while we were hoping to be prepared for such an event, such preparation was not successful. And also, I think for someone who is a public health practitioner also, it again shined the light on something that I think many of us are keenly aware, which is the disinvestment in public health that has gone on for decades as well. There's been much more attention paid to the healthcare system, the hospitals, the clinics, and very little attention to the other side of the coin, which is the public health system, which is so fundamental to maintaining the health of people. so that was something else that again was extremely frustrating. And but I'm a very optimistic person, so I hope and hopefully we'll get into this discussion in, what are the lessons learned and where's the silver lining in terms of what we've all experienced over the past year.
So, Dr. Osman, I saw you nodding your head a little bit to what Wafaa was saying here. Especially when she spoke about some of the frustration around public health systems. Do you want to speak a little bit about that in your, over your past year of the work you've been doing on this pandemic?
Yeah, so I think, Dr. Wafaa really captured a lot of it very well. Starting off, it's been a very difficult year for many of us on a personal level and a professional level. And, I'm someone who's still very much training. I'm still very much in the lab every day. I study neuroscience and gut-brain addiction and autism, but I've got a background in public health, having worked for Public Health England for 2 years as a toxicologist, in particular looking at health system preparedness, as well as a background in science communication. And so really when this hit, I knew I would have to put some effort into communicating some of the science behind this to the public, in particular to our communities, starting with my family and then extending beyond the family to the general public. And so juggling the two has definitely been tough, but also very rewarding, because it was a scary time all round for everyone. And I knew really the only thing that would bring people comfort is data and science, and really understanding what's happening, what is this virus, how does it act, why do we need to social distance, why do we need to wear face masks, what is a vaccine, how long will it take to develop one? And so, slowly getting that information to people has brought me comfort, but I know it's also helped a lot with settling people's fears and concerns. And really, like Dr. Wafaa also mentioned, we know infectious diseases always hit poorer communities or communities that are disadvantaged hardest. And we saw this with HIV, which started off as a white middle-class man problem, and then hit the Black communities harder. And then with COVID, the same thing happened. It was actually originally people who were traveling to Europe who brought the disease with them to the States originally. And then we kind of saw it happen quicker, where it hit the minority communities hardest than anyone else. And we didn't have to wait years to see that. We sort of saw it in milliseconds. And then having your own family members kind of fall into some of these categories where you knew, underlying health conditions were more prevalent in our communities. We knew things like, being frontline workers or essential workers, living in multi-generational households. You just start to realize this is really going to hit us hard. And what can we do to prevent it hitting as hard as possible? And also using this opportunity, as Dr. Wafaa mentioned, it kind of sheds a spotlight on all these inequalities. And so in a way, that is the silver lining to this pandemic, is that now everyone's so hyper-focused on these inequalities. And so engaging in conversations like this is really useful, because yes, we suffered and yes, we died at higher rates, but what can we do about it? How can we address this going forward so that the next pandemic that hits, and I'm sure, the specialists on this panel will agree, there probably will be another one, but how do we make sure that we're not hit as hard next time? How do we emphasize the importance of health, the importance of access to proper healthcare, trusting our doctors, insurance issues? There's so many topics we can delve into there. But really, where I fall, I'm still very much in research and in academia, and the Black Lives Matter protests that broke out this summer highlighted the inequalities that we see, structural racism. And I know where I work, we suddenly noticed that there's only 6 or 5 people of color in our academic institutions. And so I've really used that momentum to try and address some of these structural racism issues that are resulting in so few of us reaching doctor level or, being able to really be community leaders.
I want to come back to a couple of things that you said in a second, especially when you mentioned health communication, because I know that that's something that you've been really at the forefront of on some of your social media channels and in other Here, yes, but let me turn to Onyema, Dr. Ogbuagu. Onyema, you've been involved in clinical trials for the vaccine. You've been at the forefront of some of the work that's gone on to shift us out of this into a different place. What have you seen? And in reference to some of the stuff that Wafaa and Aya just mentioned, how have you seen some of these disparities play out, not just in your work on clinical trials, but also perhaps in distribution and whatnot around the vaccine?
Yeah, so as has been rightly said by the members of the panel, I think it's been quite a rough year for all of us. This was supposed to be a sabbatical year for me, so I took 6 months off and was going to focus on some of my global health portfolios, and never imagined that I'd be involved in responding to a pandemic like every infectious disease doctor. There's a little bit of fortuitousness there that many of us are in HIV medicine. We know a lot about virology. We know that diseases don't respect borders. We know about pandemics. We know about disparities in outcomes. We see how sub-Saharan Africa has really been ravaged by the HIV epidemic. So in some ways, there was kind of a good alignment. And when I've always reflected on how my year has been, it's just really been in some ways frustrating, in some ways gratifying, and just a mix of emotions as to where we've been. So COVID-19 has been a stress test for health systems, and health systems in both developed countries, low middle income countries. I sit in one of the committees of the Africa CDC's task force for the coronavirus relief. And I think it's just really been frustrating to see just the huge challenges on the continents with even just being able to generate data, testing, access to treatments and now vaccines, and the disparities that has unearthed. And even here in the US, right, same thing. We've had, I think with every public health response from testing, now sequencing and all that has been frustrating, and add to that the politicization of almost everything that has gone on here, and how that really has been a huge barrier and hindrance to public health efforts. But back to the main question, just to give you a straight answer, I think that the vaccine trials have been, I think, really overperformed what initial expectations were. I think you've asked any of us, what our expectations would have been very early on in the pandemic. I think we would have put efficacy numbers, much lower than they've turned out to be. And then the frustration now is that we do have a way out of the pandemic, right? And the vaccines hold that promise, and just to see that. There still remains a lot of hesitancy around receiving the vaccine, through, some people having genuine concerns, but also certain communities who are disproportionately affected by the disease also having a disproportionate disinterest in receiving the vaccine. And trying to close that gap for me has been really challenging, and is a challenge that we're addressing through this forum today. And I'm sure each of us in the different silos have had to address. So, yes, there have been frustrations, but I think overall, that the frustrations and the limitations provide opportunities for us to do things better, maybe be better prepared for the next pandemic, like Dr. Osman said. And so I'm hoping that the lessons we've learned, on so many levels would serve us better in the future, that, whatever has been unmasked or unearthed by COVID-19, that we address them, or at least start to address them as we go along.
Thank you. I love some of the words that each of you is using, this idea of a stress test, sort of exposing these weaknesses and inequalities, but at the same time showing how these systems can perform and can be resilient as well. I think that's really important for people to think about. I want to, there are so many things I want to ask all of you, and I know that there's just a wealth of knowledge that's on the panel here, but let's take a step back for a second. There are two things I want to get to. One is, I think people don't often understand how vaccines work, right? And that's both on the individual level, what a vaccine is doing, and then also on the public health level, what it means to have a population that is now vaccinated. So I want to talk about that and how that factors into the work that each of you is doing. But I also, so I'll park that for a second just to get your brains spinning on that a little bit. But also then to, we started this conversation is titled Hope, Fear, and Trust. These are some of the major themes that we're talking about, but that also come up in the work that you do, and especially in this pandemic situation that we find ourselves in. And I wanted to throw it out to you. What do those, and I'll ask each one of you to take a word: hope, fear, trust. So we got 3 people, 3 words. Who wants to go with hope? I'll take a hand first. Or I'll pick. Wafaa, I saw your hand. So let's go with hope. What does hope mean to you in this situation?
Well, I think I am hopeful. I think for a lot of different reasons. I am hopeful that in one dimension, I'm hopeful that we can make progress in containing this pandemic. And there are lots of there is good news. I think in terms of we've learned a lot about how to diagnose this disease. We've learned about how to manage it, how to take care of people with COVID-19 better. We've also have these amazing vaccines that have been identified. There are very highly active. They're very good. They work, and they also have a very, very reassuring safety profile. And I do think that the efforts now, whether it be again locally or globally, to find a way to get the vaccines to as many people as possible, as quickly as possible, are very heartening. Of course, a lot of work remains to be done in order to really achieve this, and I'm particularly cognizant of the disparities in terms of access to vaccines and confidence in vaccines and all of that as well. I'm also hopeful, so that's kind of from the dimension of COVID-19 itself. I'm also hopeful because I think, and I see this in the many programs that ICAP supports around the world, is what COVID-19 has done is it has sparked enormous innovations on the ground in terms of problem solving. I've been amazed and encouraged by how teams on the ground, as well as the people who are working day in, day out, whether it be at health facilities or in the community, have been able to not only try to sustain the gains that have been achieved thus far, whether it be in HIV or malaria or other kinds, or maternal child health, while at the same time also working very hard to try new innovations. And there are lots of these amazing innovations that have been sparked. They've been adopted rapidly by ministries of health and put into action. So that, I mean, this is demonstrated again to me, which I've known all along, the remarkable well of innovation and commitment that's there in many parts of the world. And then I think also the other hope I have is that this maybe this pandemic has stitched us closer to each other. I think people I hope, are much more cognizant of how we're interconnected there as a global community, how we're interconnected within any community where we reside. I hope it has gotten people to appreciate healthcare workers, to appreciate essential workers, the people who go out every day and don't have the luxury of working virtually. It has also connected us across borders, because now we understand that a new variant can arise in one country and in a few days it will be in another country. So that we are maybe feel more how interconnected we are as a human community, rather this nationalism that has prevailed in many parts of the world. Right. And lastly I think the hope is that the attention to public health. I think that's really critically important, investments in public health. And I mean by that, the people who are out there doing in the community, doing the education about COVID-19, all the way to the people who are collecting the data, looking at the data, doing the contact tracing, analyzing the data, and so on and so forth. I feel like I am hopeful in many different dimensions.
Mm. Thank you. And so let's turn a little bit darker now and talk about fear. Who wants to tackle fear in this context? Okay, Aya, let's hear it.
I'm happy to start with fear. I'm usually a very optimistic person. However, we have seen a lot of fear surrounding this pandemic from the start to the vaccines, and now with the variants and everything that's happening. So I think it's important to address fear. As I mentioned, I study circuits in the brain, and I know really with fear, there's a region of the brain called the amygdala that tends to be very hyperactive. and over years of trauma, for example, this area of the brain becomes really hyperactive, whereas the front region of the brain called the medial prefrontal cortex, which is involved in reasoning, its activity becomes dampened. And so what happens is you have this fear that isn't justified, often, or you justify it in ways that are not necessarily correct. And that's something that we've seen in the Black community due to mistreatment, due to injustices. Like, I'm sure many of you are familiar with the Tuskegee experiment, a 40-year experiment where Black men were treatment was withheld from them to see how the disease progresses. And that's just one example out of many that highlight how medical injustices have resulted in the Black community having this fear when it comes to trusting healthcare workers and the health system. So fear is very important to address, because I think it drives a lot of the mistrust that we're seeing at the moment. And I think giving people that space to be afraid is very important, and to hear them out, and then to kind of hold each other's hands and lead each other through that fear, and talking about, okay, what is it that you're afraid of? All right, you don't understand how a vaccine works. Here's some really excellent science communicators who can break it down to you in a straightforward way. We heard so many concerns about the vaccines changing your DNA, and then giving people a brief insight into how mRNA works. It comes into your cell. There's ribosomes, or these printers in the cytoplasm that read the message, and they print out the spike protein. Your cell then presents that spike protein to your immune system. Your immune system has now seen the viral spike protein, and it knows how to fight it in the future. That's as simply as what a vaccine does. It's just a safe way of showing your body the virus without you getting sick, so that in the future, should you see the virus again, you're already prepared to fight it. Explaining a lot of these somewhat complex scientific principles has really, I think, helped people shed a lot of fear. And so this is where I think, as Dr. Wafaa touched on, there's a lot to be hopeful for here, because we've seen the importance of science communication through this pandemic. We've seen how important it is to put things into context. So, for example, in the UK now, I'm sure you're all aware, there's several media reports surrounding the AstraZeneca vaccine and the blood clots associated with that. But a lesson that we can learn from this is, when we're reporting these numbers to the public, let's try to actually put it into context. What are the rates of developing a blood clot from taking the contraceptive pill, for example? It's around 0.6%. However, your chance of developing a blood clot from the AstraZeneca vaccine is somewhere around 0.00017%. So communication is really important in addressing fear, and not blowing things out of proportion, and always putting them into context. So to summarize, fear has been prevalent throughout this whole pandemic, but a good way to deal with that fear is good, solid science communication.
Thank you. And so we're going to segue into trust. I was going to say, you took me back to those neuroanatomy days. I had to scratch the brain a little bit. But Onyema, let me turn to you. You are up now with trust. And I think I spoke a little bit about trust and communication, but trust, let's hear it from you.
Yeah, so I think it'll be the right thing to say that there's a trust deficit, especially between just the public and health systems, public health authorities, and some of them have really followed some of the missteps. And also to recognize that certain groups have a much wider trust deficit than other groups, as we've mentioned, regarding communities of color. And people would only follow, adhere to, obey, utilize anything from a source that they trust, and that's really important. And so, what has fueled this mistrust? I think we've talked about, unique considerations around communities of color, and just issues that are way beyond even just Tuskegee, but the perception about the systemic racism, injustices, how they've played out in many aspects. I think Dr. Osman had talked about, just the issue around police brutality, and how it leaves people feeling vulnerable, unheard, and also has them really distrustful of the system. And we've seen how that can seriously negatively impact public health and receptivity to science and breakthroughs, etc. So just want to highlight that. I think, lessons we probably have learned are that we need to have consistent messaging by authorities, things like the CDC, making sure that there's consistent messaging that's sent out there so that it's not confusing to people. I think one way that you can easily lose trust is by saying one thing and it's not panning out, or saying another. So I think that definitely has been a misstep as well. And then, I think also on the flip side, I think that we've learned that, to make inroads in many of communities of color, that utilizing trusted messengers are really important. And they don't always have to be providers of color, but just people who are recognized authorities. I think Dr. Fauci, I think there's even a poll that was done, by some researchers at Yale University, and asking people, what things influence how you perceive, vaccines, etc. And one of the things that panned out was they want apolitical messages, but they also wanted to hear from trusted messengers like Anthony Fauci. And then for communities of color, those trusted messengers could be providers of color. It could be, faith leaders in the community who have established credibility and long-term relationships with individuals. And I think that, working very closely with them, can help bridge that trust gap and deficit that definitely does exist. So, I think a lot of work needs to be done in that angle to really address what really is a barrier to uptake of, and adherence to public health interventions. And I hope we can do that, so repair that trust deficit so much better.
Awesome. And, I think there was a little bit mentioned, I'll switch gears here because I think you spoke a little bit about the technical aspects of how this vaccine works, but, which is great because you got onto that second question I had. I wanted to take move up to maybe about 10,000 or 50,000 square feet and talk about the population level rollout of vaccination or vaccines, and why, I guess when we talk about these things, hope, fear, trust, how nuanced this is. I mean, I think why people can't just necessarily be out in the streets while we're all waiting to be vaccinated. How do you explain to people how vaccination works on a population level? And what it means to be vaccinated, and why, having one person vaccinated versus 100 million or 300 million, why that really matters.
Yeah, and I'm happy to start, and then I really want to let my esteemed colleagues weigh in on this, because I'm sure I will learn a lot from what they have to say. But, everyone's been talking about this concept of herd immunity from the beginning of the pandemic, right? And people were arguing that we should reach herd immunity in a natural way, i.e. let whoever's going to catch the virus catch it, and then develop natural immunity that way. I think we know with this virus, we'd need about 70 to 80% of people to have immunity against the virus in order for herd immunity to be reached. And so just taking a tiny step back, the concept of herd immunity is if I'm immune and the person next to me is immune, we kind of act as a barrier and protect the third person who hasn't been exposed to the virus from catching the virus, because if either of us catch it, we can't transmit it. And so transmission then naturally ends. And so from the beginning, people were saying, eventually this virus is not going to be an issue because enough of us will be immune that we can't pass it on. However, I've always, didn't like that argument because it's unethical. You're talking about 2 to 3% of the population catching the virus. And we know, all the people catching the virus, and we know at least 2 or 3% of them will die from the virus. That sounds like a small number, but then when you put that again into context, in the States, I think you're looking around 6 million, correct me if I'm wrong, people dying for us to reach herd immunity. And so this is where vaccines really come in. And I think people need to realize vaccines are a very old concept that actually started in Africa, where we realized if there is an infectious disease going around, if you take the pus from a person who's infected and put it into a wound in your arm, you're introducing the infectious virus to your body and allowing your body to see it and your immune system to mount a response to it, and therefore you're now protected without getting ill. Vaccines have come in and done that for us, and the fact that we've been able, due to work like some of the colleagues on this panel are leading have done, we've been able to get a vaccine in around a year. And this is not because shortcuts were taken, but because of the amount of funding that was thrown at this vaccine. And I think people need to realize that this funding didn't come from the pharmaceutical companies, because vaccines do not make money for pharmaceutical companies. Pharmaceutical companies actually didn't want to do this because they knew they would lose out. It was governments who footed the funding of this. And so having the whole scientific community kind of shift its focus to developing a vaccine and getting it to us has changed the progress of this pandemic in a massive way. We're now able to work towards this herd immunity in a safe way without having to risk losing 3% of our population.
I'm going to jump in there for a second, because I saw a couple of head nods going on here for a number of the things that you said, but also about vaccines not being profitable and not necessarily something that our wonderful pharmaceutical companies like to do. So I'm going to throw that open to our other two panelists and just to comment on that, because I think this goes into how the vaccination process works, and also, why it's how we get to a lot of people getting vaccinated from not having a vaccine about a year ago.
Okay, so if I may jump in, I think one of the obvious lessons is you can have the most highly effective vaccines, and if you're not able to produce them in a timely manner, distribute them, get them into arms, that all you have is effective vaccines and no vaccinations, right? And I think that's been a hard lesson there. And I think it's, again, we've talked about stress tests. I think that, we've seen just how challenging it is to, even when you have vaccines, to be able to roll them out in a meaningful way on a population level, and, how to triage who gets the vaccine first, depending on what you're trying to achieve. Should the focus be blunting mortality? Should it be blunting transmission? Because you get very different answers if you ask any one of those questions. And also, we've talked about equity with vaccine distribution, both between rich countries, poor countries, having at least the financial means to be able to access some of these. And again, like we said, even population level disparities in the United States between, other races. So I think that, again, that's really been the challenge with being able to get the vaccines to truly have that public health impact, translating, vaccine efficacy into real world effectiveness, right? Is really what the goal has been.
I think just to add, and thank you, Aya, you gave a most lucid explanation of herd immunity. So thank you. That was very, very helpful. And I also, I think in some ways when people always raise the issue of their concern about how fast these vaccines were developed, and we all make provide the information that you provided, there was enormous investments from the taxpayers, from people, not from the pharmaceutical companies, because the governments knew that there is not much incentive for these companies to invest in vaccines, as well as, of course, there were also, what made it happen fast is that there were also these, the technology was there. So it didn't need to be invented from scratch. That's important. I think also people volunteered for these studies on the vaccines. The altruism, the commitment by people to volunteer for these studies was so important, and volunteered in large numbers across the spectrum of our societies, I think is really encouraging. It makes me think that, we've sort of gotten used to this idea that you need 12 years or 8 years to get a vaccine. Now we should question that and say, no, it shouldn't be that long, whether it be for the next childhood vaccine that we need to develop, is that with this focus on priorities, the right priorities, the population health priorities, is that we should be getting vaccines out as rapidly as was accomplished for these COVID-19 vaccines. I think another dimension that I find extremely reassuring is not only that these studies included large numbers of participants, between 15 and 40,000 people participated in each of these studies. So you can add all of these vaccine studies, you get up to 200,000 or even more of a very large numbers have been in these studies. And the studies showed us that the profiles were favorable. Is that we're also seeing an impact in the real world, as I think was mentioned, is now we're seeing that in communities and in countries where vaccination is advanced more rapidly, we have seen a blunting of the numbers of cases of COVID-19, which is very reassuring, a blunting in deaths. So I do think that the combination of reassurance in terms of the reason why the vaccines were developed rapidly, the data from these studies, as well as we're now the evolving and accumulating real world evidence that these vaccines work. Again, I'm the optimist. I think one of the questions people always ask about, hesitancy and getting confidence in the vaccines is I'm a strong believer that as people get vaccinated, and then somebody who's kind of been in this wait and see mode, and they start seeing their neighbor, their friend, their family member getting vaccinated and doing just fine, that also in and of itself, just by this peer exchange of information and peer assurance, that I'm hopeful that this will also be a motivator to more people who have been hesitant or have questions to seek vaccination themselves.
So I want to bring it back to something that I think all three of you have experience with, and just mentioned in terms of seeing people. Wafaa, you just said seeing people get vaccinated. I mean, this takes me to the ways that we communicate about this vaccination. But to take it one level deeper, I mean, and I think this has come up, possibly in your work around HIV and treatment as well, or how you message HIV as a disease, moving it from something that is, oh my God, terminal, that's the end of it, let's stay away from you, stigma, etc., to something where it's like, we can deal with this. Like, we have plans, we have the tools might not be perfect, but they're the tools we have, and we can actually prolong, save, transform lives with this. That's one. And then, but moving it into also specifically how you communicate to minority communities, whether we're talking about on the continent of Africa or here in the United States. And I think this touches upon the work that all of you have done, whether you're talking about the HIV work that you've done in the past, the work now around COVID, or just health disparities work in general. And so I wanted to put that out there really quickly to get your thoughts. Onyema, let me start with you in terms of your thoughts on that.
Okay, I think, again, it's really just all about communicating, right? Communicating in a language and a way and context and formats that people can understand. It has really critically important, not in doctor or scientist speak, but in a language that people can truly appreciate and understand. I think there also has to be some effort to try to understand where people are coming from, because I think there's no homogeneous approach that works. I think people, have very different concerns, about, vaccines, and you need to be able to address those, head on in ways that they appreciate and that address the concerns. And again, just being a messenger around the processes and safeguards that do exist, right, in all these processes. For example, in the vaccine process, we've talked about how quickly they were developed, and Dr. El-Sadr talked about how, if anything, we didn't rush things, but we've learned to do things more efficiently, and now have a template of how collaborations involving so many stakeholders can result in huge, rapid success for addressing a contemporary public health issue and plague or pandemic, and whatever we want to call it. So I think that those are critical things that we probably need to do better. I've always been amused at just how much health information people consume from interesting sources, like WhatsApp and Facebook, and it's kind of been a challenge for us, because we don't, even as healthcare providers, public health officials, perceive that those are portals of information. And then you even start to wonder, how do you start to address that circulating video of someone having a syncopal event after a vaccine? And, we've seen that bad news gets greater traction nowadays. There's lots of sensationalism in the media. Bad news gets, hyped more than anything else. So, our work is cut out for us. And I think, again, it's just really chomping at the bit, putting out facts and data, not like geeks, right? But like, human beings from communities. And like I said, communication is an art, right? And, just knowing how to pass across this message, tailor them to whatever audience you have, use tools that are available. I think, like everyone has said, it's been powerful to take the vaccine publicly, put up a sticker, "I've been vaccinated," on, your social media feed. I think Dr. El-Sadr talked about even just that bandwagon effect of, my friend or family member, got the vaccine and everything. So I think it's, all full, all, what would I say? Whatever, approaches that we need to take with this, just no one way. And I think that that's the way we start to address that.
And I want to quickly go, because I've been on your social media channels looking at how you've messaged around some of these issues around vaccine. Let's talk a bit about social media and how, like, we've got a negative side, but we also have a positive side. What's been your experience?
Yeah, I think I'll probably end up echoing a lot of what Anwan just mentioned. It's a skill. It really is a skill, because people's attention spans are surprisingly short. Most people don't want to read. Most people do well with videos over written text. And so trying to tailor the perfect way to communicate these short, useful videos to people that can circulate in WhatsApp and all these other platforms as easily as misinformation can is quite tricky. But something that I've actually seen recently, and I know it was quite controversial, but the Saturday Night Live stint that they did, where they, asked a bunch of people of color, why are you not taking the vaccine? And I know there was like an uproar on Twitter, and a lot of people were angry at the way Black people were being portrayed on that sketch. But I think something like that could go a really long way in delivering the correct information. So, using humor, but, for example, once everyone answered, if the host would then give them the correct information back. So, somebody mentioned Tuskegee, and then somebody saying, well, actually, a lot of the survivors of the Tuskegee experiment have advocated for vaccination because it was something that was withheld from them. And so using humor and just knowing, I think you have to have a lot of understanding of human behavior to be able to get around some of the hurdles that we faced with science communication. It's something that I'm passionate about, and something that I hope with time I'll have more time to do it, because right now I'm still training. So for now, yeah, we've been using social media. There's been a lot of great scientists who've jumped on platforms like TikTok and made really cool short dancing videos explaining how antibodies work. And, short videos like that will circulate a lot quicker than a heavy video where you're breaking down mRNA technology and variants and how, viruses mutate. And then also Clubhouse came around a while ago. I don't know if anyone's familiar with it, but it's just a voice-only app. And some of the biggest researchers and scientists and leaders, it was made exclusive at first, and it's still exclusive, but that was really useful in connecting with people and having all these doctors on this one platform, and then people would just ask questions. And obviously there was a lot of anti-vaxxers on there, and there was a lot of headbutting that happened. But I think something important to highlight in this discussion today is actually vaccine hesitancy is dropping in the Black community. I know a recent poll found that almost 61% of Black adults in America were planning to or had already gotten the vaccine. That's a huge uptick from the 41% that we saw in November. So we know hesitancy is dropping through some of my work with the New York City district, with some of the church leaders in Harlem. We know their community is now coming around to the idea of vaccination. But now the next hurdle, which I think is really also quite important to talk about, because it helps build trust. People know we understand what you're facing, and that's accessibility now. New York State has a really good tracker where you can see vaccine delivery by demographics. And we know, for example, the white community, who make up about 70.4%, 76% of them have been vaccinated, whereas the Black population, which makes up 17.3% of New York State, only 10.3 have been vaccinated. And that's not purely hesitancy, that's now accessibility.
Right.
So, go ahead.
No, because those numbers are intense, but they also bring us to another question that just came up from the audience, which I wanted to throw to Wafaa, to Dr. El-Sadr, which is, and to all of you as well, but it's this idea of accessibility, but also on top of that, a question came through about vaccine passports, right? Because it's accessibility and then mobility. And I wanted to put that out there as well, to sort of jump off of Aya, what you were saying, Wafaa, to just get your thoughts on that, accessibility and mobility, and how that's going to impact who is able to return to a quote unquote normal life.
I think these are very important issues, and I think I do agree completely with Aya that is that we often sometimes the issue of hesitancy is almost like blaming the victim in a way, and rather than thinking about the other dimension of why some people have been late to attempts to getting vaccinated, and the most important aspect of this, of course, is access to vaccines. And this is, again, for any other public health intervention, I think it's really important to think about the fact that, yes, a lot of people will come to us. They'll come to the clinic, they'll come to the vaccine facility, but that's not sufficient. What we've learned from other public health interventions, including for HIV and other health interventions, you need to take the services out to the people who need them. Otherwise, you are going to be touching the tip of the iceberg. You're not going to be reaching the full spectrum of all the people who need that service. So this idea of enhancing access and going to the people who need the service is very fundamental if we are going to get to the levels of vaccination coverage that we all are seeking. And I'm encouraged that now there are lots of more efforts to think about, to build on this concept with setting up pop-up vaccination sites, for example, in certain communities that have been severely impacted, establishing vaccination sites at religious institutions, at churches and community centers and senior centers, and now even mobile units going out to vaccinate people in their home for people who are homebound. And I'm hopeful that these innovations will also occur in other countries as well, because I think sitting in a health facility or in a vaccine site and hoping that everybody can come to you is short-sighted. So there are lots of these, the addressing access is very, very critical. And that leads me to the issue of vaccine passports, where you just mentioned, Uzo, which has been big in the media and in social media. And obviously, I think probably in the name passport, vaccine passport is a little bit of a misnomer, because I think of passport as what I pull out to go across borders, across countries. And right. What is being conceptualized here is much broader than that. It's not just to go from country A to country B, but it's to be able to access certain privileges, to be able to access certain venues, to be able to access, sporting events, theaters. Now people are talking about potentially also, accessing restaurants and so on. So what ends up happening is that you are now dividing people into those who are privileged, who've been vaccinated, and those who have not been privileged. And there are lots of concerns about security of these technologies and so on, but I think it's a little bit premature to think of such certificates, I call them, because at a moment when we have scarcity, we still have a disparity between high demand for vaccines and limited supply. And until we're able to create, to have the demand and the supply meet or be consistent, and until we can reach as many people as possible with access to the vaccines, we are unfortunately going to be giving very few these privileges and depriving others of the same privilege. So It is something that's being considered, but I think to do it now is premature because of the huge issues around access to vaccines that remains, not just in the United States, but also all around the world.
Mm. There are too many questions I have, and I know there are more questions coming in, but we're coming around to the amount of time we have for the discussion, which always is so unfortunate. I do want to ask before we start moving out, one thing I want to say to folks is that we have a poll that will come up just to get your thoughts on this presentation. And on the discussion we've had with our esteemed guests. So if you'll just take a second to fill that out. But I wanted to, before we close, just go to each one of you and ask for what do you want to leave people with as we talk about COVID-19, hope, fear, and trust? What's the one thing that when people hop off this Zoom and go back to their daily lives, although I don't know why you'd want to hop off the Zoom, what is the one thing that you want people to take with you? Let me start with Onyema. Why don't you go ahead and what's the subway point that you want folks to leave with?
I want to give everyone hope. I think it's been a very difficult time and challenging time for us in so many ways. I think the impact of this pandemic, we'll continue to learn about so many decades from now. But I think so many good things have happened. I think Dr. El-Sadr talked about just the innovation. We've even learned new vaccine approaches that can serve us well for other infectious disease and just hold so much promise and potential. So I just want to say, I hope in the end it's a net positive after a lot of the negative things that happen, that maybe if we build better systems, if we're ready for the next pandemic, if we address disparities, if we take positive steps that we've learned from this, maybe in spite of all the death and loss and depression and anxiety and all the things that we faced, I hope that we'll all come out as a global community, with our fates tied on so many levels, better.
Aya, I'll turn to you.
Yeah, I think it's essential to end with leaving everyone with hope and the possibility of trust in the near future. I think I want to leave people knowing that there are many people working towards addressing a lot of the inequalities that this pandemic has shed a light on. We know seeing people like Kazmika Corbett on the front line has increased the number of young people going into STEM and science education. And the more African students or people of African descent we have in these fields, the more chance we have of addressing some of these disparities and making sure the next time there's a pandemic, and hopefully there won't be, but the next time there is one, it finds the Black community in a better state. And so I just want to leave and end with that. There is hope. There's people working day in, day out to address these disparities. If you're ever feeling fearful, turn to data, turn to information, turn to resources, turn to some of the leaders and ask them for these resources, and they're more than happy to share, and then disperse that information in your community. And so, yeah, that's what I wanted to leave people with, hope and the possibility of trust in the near future.
And Wafaa, let's close it out with you.
Okay, I guess I agree with my colleagues. I think I see hope. I think we see the light at the end of the tunnel, but we still have to go through that tunnel. I think for now, I would really say that this is not the time to ease on all the protective measures that we've been advocating and adhering with over the past year. This is not the time to put away the masks. This is not the time to go to crowded events. This is not the time to ignore the distancing that's been so important. This is the time to double up, actually, and really hold on to these preventive measures so that we can walk safely through that tunnel until we reach that light at the end of the tunnel. So please continue to, I have my mask here right next to me, and continue to observe these protective measures. They are really very, very vital in addition to vaccination. We need both. We need every tool we have in our prevention toolbox. Thank you.
So I will say to Dr. El-Sadr, to Dr. Osman, and to Dr. Ogbuagu, thank you all very much for joining us today, for sharing your knowledge, your insight, your experience, and also your hope for what we can expect coming out of these dark times. Thank you all very, very much, and we hope to have you back at the Africa Center sometime soon.